Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
All the rain we've had this spring has made it one of the worst allergy seasons ever, and asthma is on the rise, especially in children. Here to help parents with diagnosis and treatments concerns are Dr. Sue Hubbard. She is the award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Angela Moemeka, medical director for community health at Children's Health. Good morning, ladies.
Good morning. Good morning.
Okay, Dr. Sue, what is the true definition of asthma, or as some call it, reactive airway disease?
Well, reactive airway disease, or asthma, is a condition that causes inflammation of the lung and swelling, and it's chronic, which then leads to wheezing.
What age do we typically see wheezing?
You usually start seeing it, or we start identifying it as asthma, is between the ages of 2 and 5.
Okay. Is wheezing considered asthma?
Wheezing, not all wheezing is asthma, and that's why Dr. Moemeka is here, who's the expert on this. He's going to tell us more about what is wheezing.
So wheezing is something that happens in the lungs of children who have asthma, and it's because the airways are much tighter and often have mucus in them. So as air is moving in and out of them, you hear that whistling sound when your doctor listens with a stethoscope.
Yes.
What you see as a parent, usually as the most common symptom of asthma, however, is intermittent coughing that happens usually when a child is exercising or at nighttime.
Dr. Moemeka, tell us a few more of the symptoms that we should be looking for when it comes to asthma.
Absolutely. So coughing, again, is the most common symptom, but you can also get chest tightness, and children will complain that it's difficult to breathe in or breathe out. And then finally, you might notice that they're having a lot of heavy breathing and might have shortness of breath, or really having a lot of trouble as they're trying to catch their breath, even when they're sitting still, when they're not exercising.
Dr. Sue, talk to us a little bit about some of the triggers when it comes to asthma.
You know, the most common trigger is really still smoke, cigarette smoke. Wow. And unfortunately, we still have parents who smoke around their children.
Whoa.
Yes. Other things like dust mites cause this. Outdoor pollution, unfortunately, dander from your pets, and molds are also common triggers. But the most common trigger really in the younger set is an upper respiratory infection.
Let's talk a little bit about asthma diagnosis, Dr. Moemeka.
So asthma is a clinical diagnosis, and that's something we really want to drive home to families. Is the way to diagnose asthma is if you're concerned that your child might have asthma, you go into your child's doctor, and through a thorough history and exam, they're able to really let you know if this child is a child who has asthma, and then begin the management for that asthma.
What about treatment?
The most common treatment for asthma is albuterol inhaler, and we brought a sample inhaler here just so you have an idea of what it looks like. This type of inhaler is known as a metered dose inhaler.
Okay.
And it's the type of inhaler where you have to use a spacer, which is a plastic tube that helps to make sure that the medicine goes to the lungs and not just to the mouth and the throat. For younger children, we have a mask that attaches to that spacer just so they're able to better use this equipment.
Easy to use, isn't it?
Absolutely. And the most critical part of treatment, of course, is that you are the expert on your child. Your child's doctor is the expert on asthma, and you work together to create what's known as an asthma action plan or an asthma management plan. And this is a written plan that you can then take to everywhere where your child plays, where your child learns, where your child stays, so that everyone from grandma to childcare to the school nurse knows how to manage that child's asthma.
Now, I know you have a new health app that you've developed. It's called My Asthma Pal.
Yes, and that was actually a name that we got from a lot of our patients learning and talking about how they want their asthma managed at home. And the My Asthma Pal app is actually going to be out in version 2 this spring, but it is currently available to download on Apple and also on the Google Play Store.
Log on to childrens.com for more information about asthma. You can also follow Children's Health and the Kids Doctor on Twitter and Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.